Shifting our focus to hotspot Kerala now. With Kerala witnessing a worrying surge in COVID cases, the Health Ministry has written to the Vijayan government. In its letter, Centre has asked Kerala to focus on vaccination and ramping up containment measures. The Centre, in its letter, has emphasized that Kerala has witnessed a sustained and significant COVID transmission since July 2021, emerging as one of the top contributors to daily new cases in India. The Centre also highlighted that despite Kerala government's efforts, state's positivity rate still remains above 15%, signalling high and widespread transmission. In fact, amid the rising COVID cases in Kerala, the state government has called for sero survey across the state. The survey will test prevalence of COVID antibodies in those living in slum areas, rural areas and also coastal areas. The survey is going to focus on expecting mothers, those above 18 years and children between 5 to 17 years. And in fact, amid all this, Kerala CM Pinarayi Vijayan has reacted strongly to the criticism over state's handling of COVID crisis. In an article penned by CM in CPIM party magazine Chinta, CM said that there has been no oxygen crisis related deaths in the state and no one has been denied any medical aid. He went on to say that some people are deliberately trying to instill fear by quoting high COVID numbers and that the state has not wasted a single drop of vaccine. Right, so Kerala CM has went on record and has defended the Kerala COVID model at a time when the state is witnessing a huge surge in COVID cases. In fact, today is the third day when the state has recorded over 30,000 COVID cases, and CM, in an article that was penned by him in one of the CPIM mouthpiece, he said that there has been no oxygen-related deaths in the state and no one has been denied any medical aid. He went on to say that some people are deliberately trying to instill fear by quoting high COVID numbers and the state has not wasted even a single drop of vaccine. Remember, the surge in Kerala has been a cause of worry for the entire country. And if we talk about what the health minister of the state is saying, the Kerala health minister Veena George has said that state is conducting testing on war footing amid sharp spike in cases and urged the people to follow COVID appropriate behavior. Let's listen in.
See, the second wave started in Kerala by the mid of April. We had a peak on May 12th. On May 12th, the number of cases on a single day was 43,529 and the test positivity rate on that day was around 29.76%. Then the cases started decreasing and the TPR was like a plateau around 10%, 11%. But then now the cases are increasing, like yesterday it was 33,000, day before yesterday it was 33,000. We are asking the people to have to follow the COVID protocol, to follow the to have COVID appropriate behaviors, and what we are trying to do is that to contain the disease, we are identifying every single case. So if the test positivity rate is increasing in a particular area or if the number of cases are increasing in a particular area, what we are doing is we are increasing the number of tests by 10 times, 5 to 10 times, so that every single case is getting identified. We are making sure that every single case is getting identified.
To talk a little more about Kerala's situation, I am now being joined by our correspondent Vivek Karindalam. Vivek, good morning. If we talk specifically about the statement that has been given by Kerala's CM and how he has defended the state COVID model, while he's saying that it is the only perfect model which is present in the country, he has cited that there has been no oxygen deaths, no vaccine wastage in Kerala, which might be true. But it is also a well-known fact that any strategy to fight COVID, which is adopted by any state, is subject to changes and should be flexible and should change with the current scenario. Is CM trying to convey that he is not open to do that?
Exactly. Chief Minister Pinarayi Vijayan has been saying right from the beginning that if you look at the number of tests and also the vaccinations, in the state, if you look at the population-wise and then you compare with the ratio of vaccination, then it is the highest in the country. And also the vaccine wastage, if you look at, even the central government has agreed to the fact that the wastage is the lowest as far as Kerala is concerned. Also, he says that during the first wave, it was the Kerala model of COVID management which was applauded throughout the country. But now what is happening is that after Onam and after Eid, the number of cases has been increasing, and it has reached at least to 60% of the total cases in the country, which is indeed a matter of concern. It was a TPR-based strategy which was used earlier to identify COVID, but now it is the WIPR model, according to which, if you take a sample of 10,000 people in a place, and in that, if there are 10, cases, if there are 10 cases continuously, if it is more than 10 cases in that area, if it's been tested positively for continuously a week, then that area will be identified as a containment zone. Yes, what the Chief Minister has said was true to an extent, at least till the month of May. But after that, if you look at the number of casualties also, it is also very high in Kerala. And that is also something which has been raised by the central team which came to Kerala 2 weeks back. And also the home quarantine rules have been violated significantly, and that has even been identified by the central team, and also the state government has identified that. So there are a lot of issues on the ground which is not going well as what the government is expected to, because the number of cases and the casualties are also high. And hence, Chief Minister Pinarayi Vijayan has now decided for a complete lockdown on Sunday, and also ensure that on the other days there will be certain more restrictions that will be made, especially on gatherings, especially on festivals, functions, and also in places where people gather. There will be strict protocols. In the meantime, the government has decided that all the restrictions which was eased earlier, especially regarding shops and establishments, will continue. So it needs to be seen from here on how the cases are going to be, how the government is going to manage the situation, because the health minister, 2 weeks before the Onam, has clearly said that, there are chances that the cases could go high after Onam, especially after 1 month after Onam, but then it will come down. So now it's been around a week that Onam is over, but the cases have touched 32,000 as of yesterday. It needs to be seen in the coming days as how things will pan out.
Right, Vivek, thank you for sharing all those details. Time to slip into a very short break. Stay tuned to Mirana.